Welcome and step into the minds of addiction and recovery. Hello, I'm your host, Brett C. It is an honor to bring into light one of the darkest aspects of our society, addiction. With 20 years of active addiction and 20 years of sobriety, I hope to bring together all listeners on a journey of inspiration and education. With my co-hosts Jared F. and Rich J., we will be sharing our experience, strength, and hope for all listeners to enjoy and have fun with. Now, F3 Recovery brings you the Super Sober Podcast.
Okay, welcome to the 14th episode of the Super Sober Podcast. Thanks for tuning in. Thanks for watching. Thanks for being a part of the community of F3 Recovery and the Super Sober Podcast. We really appreciate you guys with your comments, questions, concerns, and following and being a part of what we didn't know there was going to be some a part of to be, now we're on 14th episode here. We are going to have another special episode, the first back-to-back guest on the Super Sober Podcast with Dr. Allyn Resch here. So if you didn't check out episode number 13, that would be a wise thing to do because we're breaking down the central nervous system, the body connections between mind, body, and spirit, everything here on the Super Sober Podcast like we've been talking about. It is happening and we're going to be continuing. So on the last episode, I kind of locked her into the next one. And then my wife was like, you got to have her on part 2. You can't just leave your listeners, hanging on the edge right there of what's going on. And I'm like, I wouldn't do that. And she's, so she was gracious enough to come back so soon. And here we are on this 14th episode. So on the last one, we went over the central nervous system, breath work, how to connect. Just the whole fight, flight, and freeze scenario with the sympathetic nervous system. A lot of foundational work. And then on this episode, we're going to even go deeper into the body. So everything's connected. Just want to let you know, my name's Brett C. I'm your host. I have a sobriety date of 4/21/03. I've been a RN, a nurse, working in the hospitals in the medical community for 18 plus years. And I've been working in chemical dependency for this is my 10th year. So things have been really good and we appreciate you. And I'll move over to our host. Rich is here. He's back. It's been a couple episodes without Rich, I think. So Jared is out of town and we're always just keeping on.
Yep. All right. It's good to be back. And my name's Rich. My recovery date is October 5th, 2013. I've been working in substance abuse, mental health for since about a year, when I was about a year clean. So it's been close to 10 years now. And then a few years ago, I decided to go to nursing school. I just graduated in December with an ADN. I'm working on a BSN. And so I'm just going to keep it rolling. Thanks.
And go ahead and introduce yourself, Dr. Allyn.
Yeah, so I'm Allyn Resch. I'm from Mississippi. Last time I was in Portland talking to you guys, but I'm home today. And I'm a medical doctor, so I'm board certified in internal medicine and pulmonary and critical care. So my medical work is in the ICU, but then because of so much chronic illness that I've seen that I feel, and there's science to back it up, related to previous trauma and our stress responses. I do this whole completely opposite thing, maybe from the ICU, but I do think they're related, where I work with people more in a coaching role for whatever, helping them make the connection between those things and then what to do about it.
Awesome. Yes, that is exactly what we want to talk about. The whole picture of health, the whole picture of how we heal, the whole picture of the mind, body, and spirit is what we're moving into. I mean, this is a recovery podcast on addiction, but it's good to know what else is going on and how much healing needs to happen in recovery. It's not just the 12 steps and we're done. The program of recovery is very clear on getting extra help, getting therapy, doing deeper meditation, and all of the health that needs to be done to get back to at least a baseline of health these days. On the last one, we went into it, Jared kind of smacked it down. We're talking about hereditary trauma passed down from generations, what we see in our society. And it seems like it's coming up to us right now in these few generations previous and a couple more coming up here is this big, huge movement. And we have doctors and medical professionals and the world of recovery and just everybody coming out of everywhere with all this information. Science has been bridging the gap and going inward. And we have doctors and everybody like coming out just talking about it, from Nadine Burke talking about the ACEs test. And that was a big one moving forward, and a lot of other of them with their platforms going through. So what we wanted to touch on from the last podcast, which Dr. Allyn was like, we could talk for hours on more different subjects. Whatever which one you want to start with on our topics here, which would be like the heart brain, the gut brain connection, the immune system, how it's related, the Fawn response, which is something I'm not very knowledgeable about or anything. And then cancer, the big C. I mean, woo, everybody doesn't want to get that diagnosis, I'll tell you that. And it's like, can you be doing a lot of proactive work here? So I know in recovery, we're more into being proactive from now on instead of reactive. So why don't you just take it from here, Dr. Allyn, and we'll just get into the free form flowing like we did on the last one. No pressure.
Well, please interrupt me anytime. Well, and first I'd like to say, how addiction relates. I believe that addiction is an adaptive response. So it's a response to how to deal with stress for, even if you're not aware of that, I totally believe in the, addiction as disease model. It's not a moral failing. It's an adaptive response, just like some of these other adaptive responses that we'll talk about. For me, I don't have an addiction. That's not my personality. I don't really like the way I feel when I, drink alcohol. So I just don't really do it. But I have other things, that are equally likely to make me sick, as we'll talk about.
Right.
So first of all, I'd like to define trauma, because I think there's two things. Like, it's kind of a buzzword right now. Like, something, people, you would be like, oh my God, that was so traumatizing. And it downplays the word a little bit. And then the other side is, I haven't had any major event, so I don't have trauma. And really, someone without trauma would be an outlier. It's more, where do we fit in the trauma spectrum?
Trauma spectrum. I like
that. And so everybody's isn't equal, but trauma is not what happens to you. It's what happens inside of you that gets lodged in your nervous system. So if you think about it like a car accident, the trauma isn't, or the injury isn't the car accident. The injury is the concussion that you got in the car accident. And so it's the same way, which is why two different people are going to have different levels of trauma from the same event, because they're not going to experience it the same way. And so that's right. It's really important not to compare. This isn't, whose is worse, and well, I had that and I don't feel that way, so you shouldn't. It's everybody's different, and your response is valid, even if it doesn't feel like it was that big of a deal. It doesn't matter. It's what's happened to you. So we have, Dr. Gabor Mate says, we have feelings to tell us what supports our survival and what detracts from it. And those feelings don't come from the thinking brain. So if you think about it, feelings are originating below the cortical structures, which is why we can't think our way out of it. So they don't originate in the thinking brain. So we can't think our way out of it by saying that's not a big deal, or that's not still happening. You're safe now. Those things are coming from a lower level. And so we have to get to it from a lower level.
Yeah, I love how you connected that process because so many people can just, it's always a comparison game. It's like,
Mhm.
oh, well, it didn't happen to me like that. And it's like we're getting into a really deep dive with a lot of it of talking about, well, how your coping skills were. I mean, a lot of us in addiction and a lot of other people, like, especially in the medical community, what we would see on a daily basis and how sickness is and everything is just like, oh, well, that we've been able to compartmentalize or maybe push aside,
Mhm.
and what we would think that would be like, "Oh, that's not very traumatic. I went through the same thing." And it's really good that you came with that, visual of a trauma response spectrum of that because someone can 2 people just like anything. I mean, 2 people can come up from the same upbringing and have totally different outcomes, and then 2 people could have the same coping mechanisms placed in,
Mhm.
and then one utilizes it, the other one doesn't. And so thanks for pointing that out to get us a
Yeah.
good baseline of like, hey, you're feeling how you're feeling, and then where it comes from. And there's a biology behind all of this. And we're going to follow the biology with this.
Yeah, and so the coping mechanisms, like you're talking about, those are important skills, but those are temporizing. That's like taking Tylenol for your headache. It's temporizing it, but if you're continuing to have chronic headaches, do you just want to take Tylenol your whole life, or do you want to deal with what's causing it?
Mm,
And you know, um, so coping mechanisms, another word for that would be like response flexibility. So I can choose how I respond to a certain situation, but that choice is coming from our thinking brain. And so if my survival brain, like, it's going to take priority, right? So I think we talked about this last time. If the tiger is coming at me, it would not be in favor of my survival if I had to make a thought and a choice about what's that tiger's intention. Is it going to come at me? What should I do? And so, as a survival response, that the survival brain takes over and takes away that choice, and it's
mhm.
going to go into fight or flight first. And if those aren't going to get me out of the situation, then it's going to go into freeze or fawn. And so that's going to happen, and I don't have a choice in it. And so until I deal with, whatever in that case with the tiger, that's how it's supposed to work, right? I need my survival mechanism so I can escape the tiger, and then I survive and I go on to live another day and everything resets. But in our lives, what happens is I'm constantly triggered by something that isn't the threat, but because I have those, that trauma stuck, it's stuck there. I'm
Mhm.
not going to have the choice necessarily to deal to use that coping skill. I'm going to lash out, or I'm going to compartmentalize, which can be just as deadly. And we'll talk about that when we talk about cancer, how kind of denying those feelings. So I think you have a slide you could pull up with the trauma responses.
Yeah, he's been
It's like,
putting those up. There's a
it's
couple
like
of
a
them on
circle.
there.
So briefly, because we went over this last time, but we've got, I think everybody knows fight, flight, freeze. So fight, I'm gonna fight, which would be anger, lashing out. In a social setting, you might not actually get into a fist fight, but if you respond with, unreasonable anger, that would be a fight response. Flight would be running, but a lot of times we're not actually physically running away from something. It's more that I'm just not going to deal with it. It is a flight response. Sometimes I'm out. I'm not engaging in this, when it's something that I should be engaging with.
Mhm.
And then freeze, is like the play dead response. And that can be the compartmentalization. So where I'm just denying basically that it's happening altogether. And in the medical world, sometimes that's necessary, right, to get through our day, because I
Yeah.
can't have a breakdown because I just watched this person die in the ICU. I have to go to the next patient that needs me. So I compartmentalize that. But the problem is we never come back to it, right?
Yeah.
or it's still there and I go home and I drink because I don't want to deal with it, And then Fawn, you mentioned that you're not sure what that is. So Fawn is when we yes the threat. So I think this is more common in women maybe, but this is the people pleaser. So I'm just gonna keep you happy, which keeps me safe. So a lot of times people that grow up in a chaotic environment, maybe with an abusive parent, they're always reading like subtle cues for body language and walking on eggshells, trying to stay safe, and then change their actions to help mitigate that. This can also be, so that can happen just, throughout life in small situations, but this can also happen in big traumatic situations like a sexual assault. So sexual assault survivors I've worked with, a lot of times there's a lot of shame because they'll say that they didn't fight or scream or anything, but this is the yes, the threat. So if I fight or scream, I might get killed. But if I just kind of go along with this, maybe I'll get out of this alive. And that's a survival response. That's not a choice. So I would think about fawning as, so they called it fawn just because they try to make it start with an F, right? For fight, flight, freeze, whoever named this
going
fawn.
with the F,
but that's a weird word. We don't use that word. So I would think about this as people please or yes, the threat, I think makes it make more sense there.
Yeah, that's really huge with our patient population or our population of addicts and maybe just society as a whole. But with addiction, that we got these stats that come out that 80% of the women and 50% of the men have been either traumatized, emotionally, physically, or sexually.
Mm-hmm.
And so we're talking about that response and it really coming into play for our listening population and just anybody in general that's going through that. There's this huge movement. And I'm thinking it kind of started with the Bill Cosby situation that Dr. Huxtable started going down for his assaults. And then once that came up, everybody started coming out of the woodwork. And people, I know as a medical professional and mandated reporter that over the last 5 years, I've called the police department over when we do case history and admissions on the patient population. I've made more calls all across the United States than I ever have in my whole career. And I'm good with that. And it's a lot of the times it's very dismissive on the other side because they're so inundated with just work, the police department and everything, but you never know where that's going to lead. That traumatizer, that person that's been doing the assaults. We're talking, I calling, we have to call, right? So it's not something I could just put to the side. And it's people that are 60 and this happened when they were 10. And it's like that person might still be in the community doing stuff the whole time. So, you watch CSI movies or a lot of those different shows and you can see that happening. So I really appreciate you bringing that up and just doing the correlative process with that. You got any questions on
Well,
this,
I was just
Chris,
thinking about the trauma stuff. Like, it's, kind of like what she said about how trauma is dependent on how we perceive and how we process what's going on. So it's like, for me, it's like I feel like everybody I've met that's in recovery that was using substances in the way that I was using them was dealing with something that was using it to deal with something that they hadn't dealt with. Like for me, I'm open about it. My dad wasn't there growing up. Huge piece, probably the biggest piece to why I was behaving in the way I was behaving. My dad got clean 2 years before I got clean, and we were able to mend our relationship through recovery. And being able to heal that part of myself has made it to where I have zero desire to put substances in me today. Without that, without having that relationship healed, or at least me figuring, maybe we say we never healed the relationship, right? Say my dad never got clean and like I was never able to get never able to get that, I still would have had to find some other way to process it instead of
Mhm.
just doing what I was doing, getting high all the time, right? And so,
Mhm.
and then the other piece of that is like maybe somebody didn't have the same story that I have where their dad wasn't there or something like that, or maybe somebody wasn't sexually assaulted. Maybe their trauma is, you know, their mom never listened to them growing up when they tried to talk about their feelings, and that was
Mhm.
traumatic. And that was traumatic to them, you know. So then
Mhm.
they dealt with that in the way that they dealt with it. But maybe the person next to them may have had the same thing, but to them it wasn't traumatic because they somehow found a way to deal with it that wasn't substances later on in life, you know. And so
Mhm.
it's just interesting how trauma is very subjective.
Yeah. And what you're talking about, so, a lot of times people think I didn't have any trauma because I wasn't
Yeah.
assaulted or abused, but you're
Yes.
saying like that's so again, Gabor Mate, I just love all his work. So he gives talks, and you can find one of his talks on YouTube. They're like 10 minutes or something. So we're not going to sit here and listen to it. Like even the short ones are like 10 minutes, but his main point in a lot of them is authenticity versus attachment. And so he talks about, so when we're babies, right? We babies cry when they need something. Babies don't think, is my mom going to be mad at me? Am I bothering somebody? I don't want to bother anybody. I'm just going to lay here hungry, right? So we come that way to where when we need something, we cry. But then as we get older, there can be a rub between my authentic self and expressing my needs and my personality and all the things versus what keeps me attached to my caregiver so I can survive. Because us right now, if there's somebody in our lives that we can't be ourselves with, we can just sever that relationship. But when I'm 3 years old, I can't sever the relationship with my parents. First of all, that you can't do that. Second of all, you would die, right? A 3-year-old can't go out into the world. And so the 3-year-old learns how to suppress the things that prevent their attachment. And so, like you're saying, if your mom didn't listen to you, well, maybe if you keep talking, you get yelled at, and that threatens your attachment with your mother, which threatens your survival. Then you learn how to suppress who you are. And then that can show up later as addiction, and congratulations, you survived. You survived. I'm not saying you, but a person with addiction survived by sticking a needle in their arm. You didn't die. That was your survival mechanism. And now that you're aware of these things and we can deal with them, that's the goal. And then you don't need the drug anymore to survive.
Right.
Bringing it full circle right
That's
there.
true.
Man, we're such complex creatures. How do we even, what's going on?
I know, right? And you were talking about generational stuff, to not blame the mother because the mother had trauma. And then, you can go all the way back to, Adam and Eve or the first single celled amoeba, right? It's nobody, like, it's nobody's
Let's
fault.
stop taking the blame and take
This
responsibility.
is where we
now.
are.
Let's just
We're doing it to our kids, even in our enlightened state when we're trying not to. They're going to have something that they're going to hear.
Hey, I don't
right?
have kids, but I've already thought about that. Like, I know when I have a kid, like, I'm gonna pass on some shit that like that I don't
know.
want to
You're gonna be a
pass
great
on,
father.
but like I'm
You're
gonna
be
be.
unbelievable.
I know,
I
but
know. I have
and I'll be better than I
You
was.
and Ashley are gonna be amazing parents.
I'll be better than I would have been, obviously, if I was still like in the state that I was in 10 years ago. But like I know for sure that there's still things that I deal with on a daily basis that are unresolved, that show up in the way I interact with people, and I still do harm. And I'm doing the best I can, and I'm trying to grow, but it's like, it's kind of how it is. And it's like, I'm going to pass on some of the stuff that my mom taught me that probably wasn't the best stuff. Right. And like, maybe it's unconscious, but it's like, we learn what we learn. Right. And I feel like she's right on target with that.
Definitely. Let's get into the biology here. Let's get into the heart brain. People don't know about this really. This is there's a website, a growing platform that's been going on for a long time called the Heart Brain Institute, and the neurons that connect within the brain, the anatomy that going there, the connection. You were alluding on the last episode, if people weren't going into it, the vagus nerve, which is a big one for all of us in the medical community, and bagel maneuvers and carotid massages and all these different things that go along with the heart. I was a cardiac nurse for 7.5 years. Dr. Resch is a ICU pulmonologist. Talk about bringing in the breath work and the heart and mind and everything. Let's enlighten the community here and people in general a little bit more about the heart brain connection.
So the vagus nerve is one of the cranial nerves, which means it comes directly out of the brain or part of the brain stem and not off the spinal cord. And when we say vagus nerve, it's not a nerve. It is a network of nerves. It comes off as a nerve, and then it branches, probably a million times and innervates all the structures that control all the things that we don't have conscious control over. So I can't make a decision about my heart rate. Now I can make a decision to go run, which will elevate my heart rate, but I can't directly with my brain slow my heart down or speed it up. I can't directly with my brain digest my food. And so all that goes through the vagus nerve, and so it's going everywhere, but there's the most concentrated area of the branches is at the heart and at the gut. And so that's where the words heart brain and gut brain come from. And so Candace Pert, who did research back in the 90s, actually coined the term body mind as just one word. So to where it's not even a connection. It's one thing, right? It's one nervous system that's coming from, the anatomical brain and the anatomical heart, but it's one thing.
We're all connected here. Well, you stop.
That you can't separate.
Separated.
And there's different. So the sympathetic nervous system also comes in. That's the counterbalance to the vagus nerve. So the vagus nerve is oversimplified is rest and digest, and the sympathetic is, the opposite of that, whatever. It's the one that speeds you up, right? It's the fight or flight kind of thing. But those have functions outside of survival. So when my survival is threatened, it's going to switch into that. But the rest of the time, it's doing stuff. It's not just sitting there waiting on that. It's controlling all of these functions. And this is where heart rate variability, that's a big popular thing right now because of all the wearable devices, the Oura Ring and the Hoop Strap, and the Apple Watch does it. And that is a measurement of that cardiac network of nerves and the health there. Have either of you guys played around with your heart rate variability at all?
I haven't.
No,
Yeah.
but I've done a lot of kind of like when you're doing breath work and stuff, and I could slow down my heart rate and a lot of meditation to connect with my heart and my mind and the emotions and releasing them and stuff.
So heart rate variability is if we took if you have this only works when you're in a normal sinus rhythm. So if you have atrial fibrillation or some other arrhythmia, this doesn't apply. But when you're in a normal heart rhythm, it feels very regular. But if you took an EKG and you measured it down to the millisecond between beats, it's not regular. So it's not a metronome. And actually, the more metronomic it gets is a sign of unhealth, a sign of sickness, right? So a lot of athletes, like elite athletes, will use heart rate variability to as a measurement for recovery and that kind of thing. But it's been studied pretty extensively, and whatever the study is, whatever the disease is, low heart rate variability correlates with mortality. So if you have a consistently low heart rate variability, you're more likely to die, is what that means. From all causes, is which is super interesting to me. And it's basically, it's a measure of health of that nervous system, which is part of the autonomic nervous system,
Right.
which gets messed up in a medical term, right, with chronic stress. And so this is probably how stress and heart disease, stress and heart attacks are related. So there was one study that looked at measured activity of the amygdala, which is your fear center, your trauma center. And the greater the activity of the amygdala, the greater the risk of heart disease. So the amygdala is communicating stress to the body, through that nervous system. And that was probably through inflammation of the arteries. And then, there's lots of evidence that people in high stress jobs and high stress, environments consistently have more heart attacks. But one thing I thought was really interesting, there was a Canadian study that looked at men that were sexually abused as children, and they had triple the rate of heart attacks, independent of any other factor. So there wasn't like they were sexually abused as children, which made them alcoholics, which made them have heart attacks. This was independent of any of those variables. So something that happened as a child can affect the survival response through the autonomic nervous system, which affects heart health.
So essentially, you could say that because we get so focused on like trauma and how it affects our mental health, you know what I mean? But it's like, this is interesting because now it's talking about how what she's talking about is how unresolved trauma can show up in chronic disease and like physical health, which is interesting.
Yeah. It's the body mind, right? It's all related. Mental health is health.
Yes, for sure.
And the crazy thing is a lot of these studies were done in the 90s. That was a long time ago. And we're still like, this is still a thing where you go to the doctor and, nobody talks to you about your mental health and nobody like this isn't like cutting edge. We're just figuring this out. What's going to happen? It's, and a lot of times people in the medical community, you get ridiculed for even, suggesting that they're related. So
yeah, it's hocus pocus. It's like whatever. Okay, we can't measure that.
Right.
Being a cardiac nurse, getting down to the milliseconds, it reminds me of all the cardiac strips I used to sometimes fill in as the monitor tech at work, measuring the P waves and all that stuff, and checking for first degree, second degree, and all the different heart complications, which happened to me. I mean, I started off with PACs, moved to PVCs, the high amount of stress, of course, over the years. I had a cardiologist, an electrophysiologist, went through all the tests. It's going into A-flutter and stressing on that every time, increasing the amount of stress as being aware of it. I wasn't even aware of it until my doctor listened to me because I used to work with him and he just doing a quick little listen on my heart. And he's all, oh, you skipped one. And I'm all, I did? Whoa. And then over the years, it just came to this point to where they weren't going to do anything. After the stress test, the Holter monitor, the 2-week test, skipping 12,000 beats in a day. And I didn't want to let him know that I had the history that I did of 17 years of meth abuse. So I knew it was going to always be correlated right to it. Oh, well, that's what happens when you use meth and stimulants. You put that many different heartbeats onto your heart. And of course, this is what's going to happen. That's going to lead to CHF. We see that. We know that. I know that. I'm a cardiac nurse for 7.5 years. And I'm like, And truth be told, through the guided meditations and taking a deeper dive, I was like pressed into doing this. I was like, do an ablation on me. For the people that don't know what we're talking about here, I mean, this is kind of a high level medical conversation what we're doing, and And it's like, well, you can't do an ablation on you. And then plus the way that I present, I'm going into the electrophysiologist's office and they're like, bro, get out of here. I'm surrounded by 70 and 80-year-olds, in the way that I present. So I myself have used the breath work that Dr. Allyn does and other doctors to heal my own heart. I am in sinus rhythm now. And I know
Mm-hmm.
once I get into a little bit elevated state, I can just breathe it off. And I use my techniques and my 12 steps and everything. And my
Mm-hmm.
ejection fraction's good. I'm good. I didn't need to get an ablation where they cauterize a part of your foci in your heart by your SA node or wherever it is in the Purkinje fibers and everything. It can be done, guys.
It's amazing.
It is unbelievable. And I'm a story of that transformation. And I'm not the only one. It's a growing thing that's going on out there. So sorry, I just had to, I guess, leave it
Oh,
out
yeah.
a little
Yeah.
bit.
And so just to
Kinda
clarify,
crazy.
you're talking about arrhythmias. The heart rate variability is for people in normal sinus rhythm, which is most of us, right? If you don't know you're in an arrhythmia, you're probably not. And so the heart rate variability, we actually want to be, the number should be a little higher. And if you can play around, this is a good way that you can monitor. If you're into numbers, it doesn't really matter, right? Because you can tell how you feel. But if you're into numbers, you can wear one of these things at night and measure, and you can kind of play with like, okay, I've been ice bathing for a week and look what happened to my heart rate variability. It's a marker. So there's different types of heart rate variability. The one that all these devices measure is recording during sleep, and it's the indicator of how active is your stress response. And so you can play with like, okay, I did breath work and this helped, or turning your air conditioner down at night and sleeping at a cooler temperature helps. And there's different things you can play with there. There are other heart rate variability, like frequency bands that you're going to have to be in a lab to monitor, and those correlate more with PTSD and disease. But the monitoring devices are good as far as just seeing what's working for your body when you're measuring.
So just to be clear, with heart rate variability, if you have a higher variability, so I think about the time between beats, right? So, and then, so a higher variability kind of, it highlights your nervous system's ability to adapt.
Yeah.
Quickly, right?
That's a great way to say
Okay.
it. Yeah.
Cool.
Yeah.
Okay. Well, man, here we go again. A lot of different tangent. Well, not, we're just, this is a lot to take in. To go through right there and just talk about the heart rate and what about the heart? What about the brain and gut connection?
So if you think about the part of your body other than you've got your skin that's interacting with the environment, but your gut is also interacting with the environment with what you put in. And so it's not just digesting your food, it's taken in, which is why, people will say, when I talk about stress and gut disease, they'll say, well, it's the food you're eating. And like, well, yeah, it's that too. None of this is just one thing. But it's taken in information, and actually if you look at the traffic on the vagus nerve, and I have no idea how they measured this, but the gut is sending 70% of the information trafficked between the gut and the brain is going from the gut to the brain. So it's picking up information and sending signals to the brain. And then the brain sending signals back. But this is one area that is new, and there's not a whole lot understood about it. But one thing that I have seen a lot with chronic stress is a lot of allergies or just intolerance to a bunch of different types of food. You know, we hear about gluten intolerance and dairy intolerance and all these things. And now there are certain diseases that, you know, it's a true allergy. But for most people, it stems from gut inflammation, which is probably just from general inflammation throughout everywhere. And so your gut should have the layer lining your gut should be tight. So stuff shouldn't be able to get through between the cells. So the idea is that stuff, food, has to get broken down and then go through the cell where it's turned into other things before it's absorbed into the bloodstream. But when you get an inflamed gut, you might have heard the term leaky gut. Right. Basically, the junctions between the cells break down, and now whole proteins, food proteins that aren't supposed to be in your bloodstream because they're supposed to get broken down into their amino acids in the cells before they get to the bloodstream, make it through. And so now I have a whole protein of some foreign substance floating around in my bloodstream, which triggers my immune system to attack it because it's not supposed to be there. And then we get these intolerances to these foods. And so the treatment is you have to get off the food to start with. But once you deal with the inflammation, which a lot of times is dealing with the stress response, a lot of times you can add these foods back and not have a problem with them.
Oh, wow. Talk about putting that together. There's a lot of people with some intolerances going on listening to that. I was listening to some doctors talk about it and talking about how the actual gut connects and sends so much information back and forth that the actual flora of the gut has been created. That flora has been building up depending on what your diet is putting in there. So that flora is connecting that information of what it wants more. So that's triggering that response of, I want more sugar, or I want more of this and that, because that gut bacteria is taking over so much of that because of what you've been feeding it. And we see
that's interesting. So then you could look at what people crave and how that correlates to obesity and stuff like that.
That's like the information coming back up, and it's like, where does that come from? And we're talking about that correlative process, not only with just the heart and the mind and the gut and everything coming in, and how the information, and to be aware of that. So a lot of the time with I've been getting myself off sugar for years, and I've always had a sweet tooth, but now I kind of just tell it to sit down and shut up. It's like, okay, let that pass, because I practice my program. I can practice that also on my food and all other aspects of my life, and just tell myself, STFU, and you're going to, you're okay. I run the show here, and it doesn't always have to be this initiating response and me react to it. I can react and control that aspect of it.
Response flexibility.
Yeah, there you go.
How you respond. Yeah.
So let's also connect here the Fawn response, because I remember the last episode that we were talking about with the big C, with the cancer. So let's, so many people out there, cancer's on the rise. We know our water's full of toxins, our air, our food to keep it healthy, and our thoughts and our actions, our emotions are all flipping toxic these days. It's like, how in the hell do we get healthy? And then our immune system breaks down because we're in high stress, and then it shuts down our immune system. Let's talk a little bit about that from your perspective and what you know about that, Dr. Allyn.
So the first thing I think is to understand the immune system a little bit more. We all know the immune system fights germs, but it does a lot more than that. So its job, if you think about it on a continuum, should be sitting right in the middle, and it's always scanning the internal environment and attacking things that aren't supposed to be there and leaving alone the things that are supposed to be there. So if I'm sitting right in the middle there, if I go too far to one side, so if it's not sensitive enough, it's missing things it's not attacking things that aren't supposed to be there. Then I can get chronic infections. And the other thing is cancers. So cells are always dying and becoming damaged. And, there's cells that are potentially cancerous in all of us, right? Because I have a cell that breaks down and the DNA isn't working right. And my immune system is supposed to deal with it. Right. It notices that is not functioning correctly anymore and it kills it. But if my immune system is not recognizing that in the body, then those cells can multiply and turn into tumors. And what's really fascinating to me is that it's been through like hundreds of studies. This isn't one study. Hundreds of studies have shown how it's been connected with the Fawn response, the people-pleasing personality type. And it's almost like the people pleaser suppresses their own needs to please others. And so there's this suppression of what your body should be fighting that mirrors it. And this is
mind-blowing right here.
That's really interesting to me. And again, these studies are from like the 80s and the 90s. This isn't new. So I'm just going to give you a few. There was a 1982 study in Germany. So there were 56 women admitted to the hospital with breast lumps that were getting biopsied to rule out cancer. And they were evaluated for suppressing emotions, rationalizing behavior in others, altruistic behavior, avoidance of conflict, and overly self-sufficient, not being able to ask for help. And so blind raters took those questionnaires that they did. So they didn't see the patient or have their results of their biopsy. And they were able to predict who had cancer and who didn't with a 94% accuracy. A British study noted that breast cancer was associated with, the way they phrased it, extreme suppression of anger and other feelings. Prostate cancer, anger suppression was associated with the diminished effectiveness of what are called natural killer cells, which are the cells in our body, in our immune system, that are supposed to go kill the cancer before you ever know, like, you don't know you have cancer. Like, there's a cell there that could be cancer, right? And it's going to get taken care of, and you never know it.
Yeah, they're doing it every day.
They're doing it every day. Women with severe PTSD had twice the rate of ovarian cancer, and the more severe their PTSD symptoms, the more aggressive their cancer. And then there's something that you may have seen in the hospital with your cardiac stuff. So anybody that's worked in a hospital in a setting where people die, maybe not, anywhere in the hospital, but in a setting where you occasionally have people die, we all know that people that are really nice have worse outcomes. I don't know but to the point where in the ICU now, where somebody will be super nice and they're really sick, and it's like they could get better, they could get worse. And we'll talk about, like, the nurse and I'll talk about, like, I just went in there and talked to the guy for a while, and then we'll be like, oh no, he's so nice.
He's too nice.
He's so nice.
He's not a fighter.
He's not going to do well. And then the people that are just jerks, like, we'll say, like, everything should be like that, they should not make it. And we'll be like, they're too mean to die. They're going to make
exactly.
it.
I'm too stubborn.
And it translates.
They got that badass immune system.
Yeah, they're just ready to. There was a guy a few months ago that I came on to service after he was already intubated, but he had COVID, had all these problems. Like, he should not have survived. He was super sick. And I called, but I hadn't met the guy because he was already intubated when I went on. And then I called back a week later just to check on people, how'd so-and-so do? How'd so-and-so do? And I was like, did that guy die? And they were like, he's awake watching TV, cussing all the nurses. And I'm like, oh, of course he is.
Only the good die young, right?
It's a thing. So there was a Cleveland Clinic study and a neurology clinic that they correlated niceness with ALS diagnosis, to the point that the nurses were writing in the charts like so these were people that came into the clinic with a potential ALS diagnosis to get more testing, and they would say it's going to be ALS. This person's too nice. And then they'd write in somebody else's chart, can't be ALS. They're not nice enough. And they were almost universally correct.
That's kind of ironic because I had a good friend just pass away from that. And
it just seems like,
wow.
So it's like people who are internalizing their stress and just holding it in, and everything's fine. Everything's okay. Just too nice.
Mm-hmm. Too nice. Yeah.
That translates to the internal, from the external to it's all internal anyways. It's not an external process. This is like you conditioning yourself to be less of a fighter, kind of.
Yeah. Less of a fighter and always just worried about other people instead of, this isn't saying go out and be a jackass. This is just like,
let's clarify that for our patient, for our listening population here.
Right. It's that, a lot of times these characteristics of, compulsive concern for other people's needs, or this overdriven hyper responsibility, repressing your anger, they get valorized, like they're so selfless. And that's really, that's confused with kindness, compassion, generosity, diligence, but with boundaries.
Right. Absolutely. And that's protecting your own energy. We're talking about, this is like going into our own energy field and everything, with the heart having its own magnetic field. I mean, you can, it's not, you don't have to wear the HRV, heart rate variability on you. It can be monitored at like up to 3 meters off the heart and the body, right? I mean, we have our own magnetic field that's going on and everything of the heart, brain. We just put that up on the screen right here. And, I mean, we have our own electrical field, and then if you're sick, that gets diminished, and that's how we can feel people. And when they walk into the room, and there's just so much going on with us. I mean, this is super insightful, Dr. Allyn.
Well, and it's, you're talking about, you can feel it once and that's part of like interoception, like learning to tune into your body, because your body knows things before your brain does.
Listen to this one, Jared. All right. No.
And there's mirror neurons in your brain, which actually so you're not only picking up on that energy, you're actually experiencing that energy. There was a study that was done in monkeys, and they monitored, parts of the brain that were active. And one group of the monkeys was being monitored and was watching the other group of the monkeys who was being monitored. So one group was doing an action, and the other group was just watching the monkeys do the action. They were like I don't know what they were doing. They were doing some playing with something. The group that was just watching, the same areas of their brain monitoring was identical. So their brain was firing where it would be firing if they were actually doing it. Right. So your body's picking up on that energy, and it's mirroring it. So you're actually having the inflammation, like it's happening. So when we talk about your environment being toxic, it's not just the pollution and the plastics and whatever. It's who you're around too.
Whew.
Absolutely.
Wow. Environmental factors, internal factors, everything putting together, taking a deep dive and looking at everything instead of just pinpointing the one spot. It's like, we're going to the well here. We're getting deep with this right here. And it's super powerful. And then looking at where the cancer is coming from, and then you being less of a fighter. We see that, the baseline, what's going on, or what we would, see the patient, it's like failure to thrive. And it's like the body's the objective observer. I mean, you can think yourself sick. Everybody agrees with that one. But what about the flip side of that? Can you think yourself well? And it's like, well, of course. I mean, we could see that, especially in our population with recovery. We see such vast improvement so quick when you're just on that lower level of resistance. And there's a whole energy chart with all that too, and different dimensions. I know that we're winding down here on 5 minutes, and we're just going to have to probably do episode 3 with Dr.
Okay,
Allyn here.
real quick, I do want to talk about the other. Give me 2 minutes to talk about the other side
no
of the
problem.
immune spectrum. So we talked about cancer and chronic infections as I'm not sensitive enough. Autoimmune disease is the other side. So I'm overly sensitive and I'm attacking my own cells.
Yeah, that's right. Let's do that real quick.
And so, autoimmune disease is this huge category of all these diseases, but they all have names for what they attack. So rheumatoid arthritis attacks, the synovium, the joints. Scleroderma attacks, and dermatomyositis attacks the skin. Psoriasis attacks the skin and the joints. Lupus attacks everything. Right. And every one of them, even if we've identified a genetic predisposition, every one of them is otherwise idiopathic, which means we know this is happening, but nobody has any idea why it's happening. And it's been shown to correlate with an anxious phenotype. So somebody that's overly, worried and anxious and which there's some overlap, right? Repressing feelings and that kind of thing too. But it's to the, a lot of times when I see somebody with autoimmune disease, especially like in the hospital, it's like, find the trauma, it's there, because their body is, so their survival response is so overactive to everything as threat that they end up attacking their own body.
Interesting. So yeah, I have autoimmune disorder. I got diagnosed when I was 19 and psoriatic arthritis. And today I'm on Humira for it, which just suppresses my immune system. But I noticed when I was in nursing school, when my stress was high and I was being really critical of myself, and it showed up, Humira or not, and it showed up in other ways. I was getting these big cysts on the back of my head. Go to the doctor, they cut it, they lance it open, they culture it, nothing there. It's just inflammation, and it was directly correlated with my stress, directly correlated with what was going on in my head, and I graduated nursing school in December, and the cyst went away completely. It's just, it's wild.
Yeah, I can get my own story on that too. When I was in high amount of stress, going to school and transitioning and building my life and everything like that too. So
and it's interesting because I'm a person who's been historically hypercritical of myself. I wouldn't say an anxious person, but just very hard on myself, and I think that you can correlate that with this, because the opposite side for with the cancer would be like the people pleasing side, or a little too nice, right? But I'm not nice to myself historically. You know what I mean? And so when you said that, I connected the dots, and it makes perfect sense.
Yeah.
It's just really interesting stuff.
And I want people to understand, I'm not saying don't take your medicine. Take your Humira.
No,
right?
No, we're not saying that.
This isn't either or. But you can also identify, like, if you start to feel that way, like, okay, I'm about to get sick. What do I need to do, to back off, and, that kind of thing. When I was in medical school, I had multiple sclerosis symptoms that went away.
Yes.
Once I stopped, once I moved on from the stressful situation, and then I started learning about this stuff, and luckily have not had it again. But
yeah, and sometimes I do think that I'm in a place today where I could potentially maybe do half of the Humira that I'm on now and just kind of see. And I think that I would probably do better, because it was way worse when I first got clean. And maybe that was because of my nutrition. Maybe that was because of multiple factors, but it could also be because of a lot of the unresolved trauma that I had and how I used to be with myself. A lot has changed in these last 10 years. So it's just really interesting stuff for me to think about. That's for sure.
We got a lot to think of.
If you're always attacking yourself, you're doing it on a cellular level.
Yeah, I'm connecting the dots here.
Well, we're at the end of another episode 14 here. Thank you, Dr. Allyn, for putting it together. I already see the follow-up for episode 3. I mean, there's so much. This is such a vast subject, and it's just like, wow, the healing is happening here. We're connecting the dots. The research is out there. So I definitely want to put a shout out to Dr. Allyn's Instagram page, and we're going to be doing some stuff. We'll probably put it on the F3 Recovery website. We're going to do a call to action. You can email us with any questions for Dr. Allyn. She's has an Instagram page. She also does her own healing modality classes that you can get with her, right, Dr. Allyn? And,
Yeah, definitely. So I do coaching, and if you live near me, I can do it in person, but I can do it anywhere virtually. And I have a website now.
yes.
And it's Doc Allyn, so DOCALLYN.com. And for people that don't have Instagram.
Okay, great. We'll on the f3recovery.org, we're doing a lot of background work too, just like Dr. Allyn is, and a lot of other people that we've mentioned on the podcast too. We'll link that up. We'll sync things together. And I want to give a shout out. So we're on, if you want to email us or anything, we're at info@supersoberpodcast.com, or you can email us at supersoberpodcast or f3recovery.org. And we got both of those emails.
And if there's enough emailed questions, we could do like a Q&A episode where we answer.
That'd be awesome.
That would be awesome for the community to get going on that. Haven't got too many emails lately. So I'm definitely going to be progressing. And then you can check out on f3recovery.org a lot of the other information, the growing platform that we have under Recovery Resources. You can check out the streaming series that I wrote called The Detox. It's a story of addiction, the deadliest disease that man has ever known. And that's a streaming series that I wrote for Hollywood. So if anybody's got any connections there or whatever, can check that out. You can see the one sheet and the PowerPoint presentation on f3recovery.org. We're going to be going in and doing some more podcasts coming up for sure. We're going to be getting with Dr. Allyn again for sure. I'm sure she's seems like she's going to lock it in for episode maybe 3 coming up, or who knows? I mean, this is so much good stuff right here. So anything you want to shout out, or any more questions or anything?
No, I just want to say thank you. Yeah, it's great to sit down with you today. And that was really great information.
Enjoyed it.
Thank
Awesome
you
stuff.
so
Thank
much,
you.
Dr. Allyn, for breaking it down. I hope the listeners were paying attention, and you can go back to episode 13. So this is part 2. So soak in 2 hours of just medical community understanding what we are and we're in the medical field and how we're dealing with things, and the minds behind it and moving forward. And shout out to Notorious JID here, Jails, Institutions, and Death, the 3 outcomes of active addiction. So we're doing it out there. This is a non-compliance issue if you're not staying sober in 2024. So we got 3 medical professionals out here saying that we can be done, and just keep on keeping on. Thanks for watching and listening.
Thank you for listening to the Super Sober Podcast. Go to our website at f3recovery.org. That's F3Recovery, all one word, .org. We're turning fight, flight, and freeze into free form and flow through practicing the 12 steps and staying accountable to change. Don't forget to keep on keeping on.